Have you ever unknowingly been exposed to a deadly disease? I learned the hard way that this does happen. Although this is a risk alone, what kept me safe from exposure was proper hand hygiene. Today I will talk to you about the importance of hand hygiene. As an ER attendant and nursing student, I practice hand hygiene every day to protect my patients from exposure to germs and infectious diseases. I also have my hand hygiene certification. First, I will tell you of the importance of hand hygiene and how it helps prevent the spread of germs and infections, specifically in healthcare settings. Next, I will explain when healthcare workers should be performing hand hygiene. Last, I will explain the proper technique of hand hygiene, whether you're using soap or hand sanitizer. I first want to say it is very important to know proper hand hygiene because it helps protect both patients and medical staff from the spread of germs and healthcare-associated infections. We want to not only avoid contracting diseases, but to prevent this transmission of those germs to other people. The World Health Organization tells us how important it is to have access to hand hygiene, not just in healthcare facilities, but also schools and homes. The more people that can get on board with this idea, the less germs will be spread. Improving hand hygiene practices through proper technique and consistency have been shown to reduce healthcare-associated infections and antimicrobial resistance. When we are able to turn this practice into a habit, we can ensure there are less germs spread. Hand hygiene is also one of the most cost-effective ways to prevent the spread of infectious diseases. It can help reduce healthcare costs overall. Now that you understand the importance of proper hand hygiene, let's talk about when you should be performing it. Hand hygiene should be performed at specified times within healthcare areas. This helps prevent the spread of germs between patients and healthcare workers and the environment. In a healthcare setting, it is important to perform hand hygiene before entering a patient's room to protect the patient from any outside germs that could be carried in by a guest or healthcare worker. Healthcare workers and guests should also perform hand hygiene after providing patient care to prevent spreading germs from the patient to other patients or people. An article written by Dr. Priyam Bose says, several studies have indicated that healthcare providers clean their hands less than half the time they should. This leads to the result of thousands of people dying all over the world from infections that were acquired while receiving healthcare. Hand hygiene is such an easy and quick means to reduce this number. If you have to ask yourself, should I wash my hands? You probably should. Other times you should perform hand hygiene include before preparing or eating food, before touching your face, after using the restroom, and after blowing your nose. Finally, knowing when you should perform hand hygiene is important, but it's only effective if you are performing it correctly. The friction created by rubbing your hands together is one of the most vital parts of hand hygiene. There are two methods of hand hygiene: using soap and water or using an alcohol-based hand sanitizer. Hand hygiene performed with soap and water is beneficial when your hands are physically dirty. To do this, you should use warm water. You should use a nickel-sized amount of soap and rub your hands together all over for at least 15 minutes, making sure to get every part of your hands, even under your nails. Then you can rinse your hands and dry them. If you're using a paper towel, you can turn the faucet off with that paper towel. If you are unable to use soap and water, you can use an alcohol-based hand sanitizer that can also effectively lower the risk of spreading germs when applied all over the hands and rubbed together until completely dry. The CDC tells us that an alcohol-based hand sanitizer does not cause antimicrobial resistance. Basically, this means the bacteria does not become immune to hand sanitizer. Instead, it destroys the germs by breaking apart the cells. In conclusion, first I shared with you why hand hygiene is essential to prevent the spread of germs. Next, we covered when you should perform, not only within the healthcare setting, but also in daily life, um, hands, proper hand hygiene. Finally, we went over the proper technique you should use. I hope that you were able to gain some important knowledge about the proper technique you should use and when you should use proper hand hygiene and how it helps to prevent the spread of germs. The next time you feel like skipping hand hygiene, remember that clean hands are the first line of defense in protecting not only yourself, but also those around you. Thank you.